Thank you. So now, I want to tell you a story. Nataka kusema wiwi, unasema wa. Wiwi. Wa. Wiwi. So I want to tell you a story, and with this story, it's very interesting. So the only task that you have, you just finish it with nda. Tell your neighbor nda. So nda mpaka nda. That is not the energy I want, guys. Nda mpaka nda. So let me start with this side. Nda mpaka nda. So that is all you got. Nda mpaka nda. Everyone, nda mpaka nda. Kuna dem anaitwa Beli. Huyu dem tayari nishampe. Inabidi nianze kucheki nje, mimi naona pu. Anyway, inabidi nichukue moja kwa moja na mpata Beli. Huku mazee alikuwa amevalia nikasikia harufu ya mre. Nikasema ndio maana huyu dem ameko. Ikabidi nimpeleke kwa kibaa. Mazeni alikula matu. Mtaani kukanza toka propaga. Atijaka baba na mkatia mangumi mateke walini osi nikalaza kwa kitaa. Nas akaanza kuleta parapa. Jaka baba mimi nakupe. I want you to be my heart defer. I want you to be my pocket koma. Akanitolea pesa kwa mabu. Najua wewe ongezisu. Anyway nilizeka chini ya ota. Tukapeleka honeymoon yuga. Mazema bibi yako nakupe. Asante sana.
Wewe hata kuwa ameniambia ameanda kitu kama hiyo. Wow. Asante sana. So we'd like to move to the next session. And I'd like to introduce to you our session, the people who will take us through the session, okay? I can see they're eager and ready and willing to be here. And so I'd like to introduce from my right, we have Miss Mercy Kihiu. Give it up for Mercy Kihiu. Lovely, isn't she? And then after Mercy, we have Leonida Yuma. Another lovely one. Now we have Anthony Chazara. Huyo tunafaa kumfanyia Wakanda And then after that we have Elizabeth Okoth. And we have Mr. Bernard Nyauchi. Asante sana. I will give them a chance to speak. And our session chair is the one and only Andrita Ikahu from LVCT Health. Shangwe na vigele na makofi kwa mdosi wangu. Tafadhali pigia mdosi wangu makofi. Iyo si makofi ya mdosi. Pigia mdosi makofi mpaka afike huko juu. Lakini asisimame huku nyuma. We would like to see you a dance. She will unajua sasa ni mdosi wangu anapatia side eye. She will dance after, sindio? Ata dance after, sindio? She must. Aya sawa. Welcome Andrita.
Thank you. Thank you Michelle. Welcome back after tea. Are you refreshed? You feel good to be able to listen to the team here for about 1.5 hours? Thank you. So I'm Andrita from LVCT Health, and I just want to, and I want to say something about our partnership with DLS that started around 2019 when they met us in our office in Kenya, and from 2022 we held the first workshop with the county of Nairobi and Mombasa to look at the MindSKILLZ as an intervention, and we were able to contextualize and adapt it to the Kenyan settings. Then 2023-2024, for 1 year we did a pilot. In Mombasa, it was education settings and also the community, while in Nairobi, the setting was in schools. And there are quite a number of lessons we learned. I think we'll hear them here, but very exciting that it improved communication between parents and pupils and teachers, and it also improved the literacy for mental health among the pupils. So there are quite a number of exciting results that you will hear from this panel. And after that, we had phase two. We had to sit back and look at the results and agree what needs to change. So there was a lot of feedback. We sat with the counties and we changed a bit of the fee policies here and there, and also the curriculum. And now we went to the implementation phase, and I think we'll hear from this team what has been going on. So I think it's a very exciting relationship and partnership that has grown with a lot of respect, that has grown with a lot of learning from each other. Ade, I'm looking at you because you are the one who made it initially for us to have this partnership. Ade, you can just say hi like this. Thank you. And without wasting any more time, I think we will ask the panel to start having their sessions. I'll call upon Elizabeth or Koth. You will look at their bios at the website. We will not tell you about, they're very experienced, by the way, very, very experienced. So when you go to their website, you'll be able to see their bio. But to save on time, we will just allow them to give their presentations. So karibu sana, Elizabeth.
Thank you, Anrita. Good morning. Yes, to all the protocols observed, our directors from the national level, the Mombasa County, our host, the Nairobi County team, all the attendees, the SOS, our Grassroot Soccer leadership. Hello. Yeah, my name is Liz Okoth. I work for Grassroot Soccer. I'm the in-country manager. I oversee partnerships and programs. As I wait for the digital team to bring the presentation to the screen, I want to acknowledge my Grassroot Soccer colleagues and partners who have joined us virtually from many different countries across the globe. So wherever you are, we give you a big kilo. Thank you for accepting our invitation to join us virtually from whichever country that you are in. Again, I want to acknowledge the Grassroot Soccer team who are here. We have 4 young people who are members of our Youth Advisory Council. So Grassroot Soccer, it's for the youth, by the youth. So we have young people between 20 and 30 that serve in the Advisory Council. They inform our policies, our programs, our outreach, our communications. I don't know if they are here, they can just say hi. There's Umi and Elvis from Mombasa. There's Gideon and Tino Esther from Nairobi. Hi. And then my colleague is here, Mercy, she'll talk. And then I just want to say that Grassroot Soccer is so invested in this partnership and this process that we've had the senior-most of our leadership here. Andy has already been recognized, our Director of Strategy Innovation. Andy, just say hi. Say habari. Habari, yeah. We have our Vice President, Global Impact and Operations, Fiona. Say habari. Okay, and of course we have our CEO and founder who talked. Say jambo. Okay, thank you. So I'll give my presentation, and I know you wonder why that particular photo. That photo shows our partnership in country. We call ourselves a tripartite. A tripartite means we partner with the government, both at the national level and the county Department of Health for Nairobi, Mombasa. You can see the Chief Officer Medical Services for Nairobi is in that photo. You can see the heads of school health, Nairobi, Mombasa there. Yeah, and the entire team, and the LVCT team, and the Grassroot Soccer team. The people who are not in that photo are our young people, the coaches, and you will see many other photos where we are with the young people. So I'll give a bit of Grassroot Soccer overview, but with a bias on our programming and our partnership. Many people, including my neighbor from SOS, said, I would really want to know about Grassroot Soccer. Do you have football teams? What do you do? I know Tommy already touched a bit on how we were started, and now I'll dwell more on how we work. Thank you. Next slide, kindly. Yeah, so we are an adolescent health organization, and we leverage the power of soccer to equip young people with life-saving information, life skills, and mentorship that they need. So globally, I think Tommy already touched on that. Next slide, kindly. Yeah, so globally, we work a lot through partnerships. It's only in 2 countries where we work directly. That's South Africa and Zambia. But you can see we've worked in around 60 countries with more than 85 partners, and we've reached over 25 million adolescents. Our most important ingredient are the young people, the coaches. And we have trained so many, over 25,000 coaches. We also believe in embedding evaluation and research in everything that we do. And we've carried out several, around 64, research studies in many countries, including randomized controlled trials. And these have really shown that all our interventions drive impact and really achieve good outcomes. Next slide. This is what makes us unique. Again, I will talk about our model, the heartbeat of Grassroot Soccer, the coaches. Coaches, hello. How are you? Yeah, so the coaches are the young peer mentors. They will do a lot of kilos. And when you leave, please go to that corner. They've set a whole place for fun for you. So these are young near peer mentors. Yeah, they are trained. They connect and inspire the adolescents. They are change makers in the community, and they deliver our curriculum. Our next unique is culture. So we have a very fun, very engaging culture that creates that safe, supportive environment, because most of the programs and most of the things we deal with, yeah, are often those taboo topics, yeah? When you talk about mental health, you had Elizabeth, director, talk about it here. You talk about HIV or sexual reproductive health, but it's so fun that it makes it so easy to connect it with the young people, and again, to have those vital conversations. And the last one is our curriculums, play-based, interactive, adolescent health curriculums, and we keep updating them because we listen to our client feedback, because we look at our program results, and because science and evidence keep changing. And of course, we don't stop there. We have to follow to see, do we have impact? Have we changed knowledge, skills, attitude, and the confidence to use it? Are the adolescents accessing the much needed youth-friendly health services? They are adhering not only to treatment, but to healthy behaviors. Thank you. Next slide. Yeah, so as again, Dr. Tommy said, we started as an HIV organization, but we have now expanded to more integrated approach of adolescent health and looking at all the interconnected health issues, including HIV, sexual reproductive health and rights, GBV, and youth empowerment. Next. This is a busy slide, and I will not really read it. What I wanted to say is, one, we have integrated mental health across all the skills programs. In Kenya, the program we are implementing right now is MindSKILLZ, the one at the very end, and we will talk about it. But we have our foundational skills, basically social asset building and primary prevention for HIV, for sexual violence, for pregnancy, for the very young adolescents, as well as for girls and boys. And we also have economics strengthening, that's the money skills. And we have an integrated program for adolescents living with HIV called Skills Plus. Next slide. Yeah, so again, because we have other people joining us online from, I think, almost 30 countries, that is our global outlook. Those are some of, those are the countries where we prioritize. Our partnership is broad, from the government to civil society organizations to NGOs to CBOs. And in Kenya, we will talk more about the partnerships next. So that's our technical assistance. So when we come into a country, we will get the government and the priorities in country. And if we have already curriculum, we go into the process of adaptation, contextualization, the way we did with MindSKILLZ. If there isn't, we get together with the stakeholders and we facilitate a process where this is done with meaningful youth engagement, and we put all frameworks and tools in place. We capacitate the in-country team to be able to deliver. Most importantly, engaging the young people, the coaches, ensuring the routine M&D, ensuring this evaluation. And always we drive towards sustaining this government adoption and being able to institute it and, let it go through the country priorities and structures. Next. Yeah, so this is the MindSKILLZ partnership. Yeah, and again, it goes back to that first slide. So we facilitate as a technical assistant partner and the prime. We have LVCT, who is our main implementing partner, and that connects to the community, to the government, and ensures fidelity. And of course, we have government that ensures policy and regulatory oversight at county and at the national level. Next. Yeah, so again, before 2022, we've had some footprint here. We did not have actual physical staff presence, but we've been there on and off with certain requests. In 2004, we had Vijana Amani Pamoja, represented here by Tino, whom again, on request, we supported on HIV programming. And in 2007, after post-election, again, we had requests from Mexico, had a program in the Rift Valley that brought together communities, and we've had partnership with the Peace Corps that implement in the Western Kenya region, 6 counties. Thank you. And that slide again summarizes the partnership. Stella Waruinge, you are there smiling very well, Selina, and all of you. Asante. Thank you.
Thank you very much, Elizabeth, for that introduction to the MindSKILL. I think next I am calling upon Chazala and... Oh. Where is Michelle? Michelle? You're supposed to do a Mentimeter. Are you ready? Okay, if you are not ready, we'll continue until you are. Okay, later. So I think I'll just call you to continue.
All right, so we had a long presentation, but cut it into different parts of it. Again, we wanted to do a Mentimeter. Okay, before I go into the MindSKILLZ program overview, I just want to check in. So what we'll do is, I want to know how you are feeling. And if you are feeling good, you are feeling okay, do this. If you are okay. And if you are not feeling okay for any reason, do this down. And remember, it's okay not to be okay, and it's also okay to be okay. So we'll do it again and check your neighbor. If your neighbor does this, kindly talk to them, check on them. Okay, let's start again. 3, 2, 1. If you're feeling okay, do this. If you're not feeling okay, do this. All right, so, okay, so you'll be able to engage with your neighbor and talk with your neighbor. All right, so... Coming way after. Okay, so we'll go to the MindSKILLZ program overview. Kindly put back the slides. For those who asked about MindSKILLZ, we hope by the time you leave here, you'll have a better understanding of what the program is all about and how you can be part of that movement. Okay, so I'm waiting on the digital team to bring back the slides. While they're bringing it back, yeah, that's one of our coaches, Coach Amida, who is here in Mombasa. Let's proceed with the next one. Yeah, so as we go into understanding what the MindSKILLZ is, I just wanted to bring the broader perspective that as GRS and through our partnerships, we really feel that, critical gap in mental health by engaging and training the non-specialists, that is the coaches and the young people, to be able to improve the mental health and awareness and resiliency of young people. And our approach is informed, through the youth-centered and trauma-informed approach. So it is more holistic, and at the end of the day, what we want to see is a resilient mind, a healthy body, and a strong support system. Next. Yeah, so we are aligned to the best practices, the global best practice and the WHO's intervention. As I said, 100% of our programs, we already have the mental health concept built into it. At the second level, we have the health promotion, positive health promotion through the MindSKILLZ program. At the third level, we have our coaches who have been upskilled to be able to provide psychological first aid, and then they're able to refer to this for specialized care as needed. Next. Yeah, so what is MindSKILLZ? So MindSKILLZ, I think if you should go away with anything from here, know that MindSKILLZ is sport-based, it's youth-led, it's preventive, promotive, and it's for adolescents. It is sport-based, youth-led, preventive, promotive, for all adolescents. So it is for all adolescents. Again, MindSKILLZ was contextualized in Kenya, as Anrita said, in 2022, because you can ask, where was it made? But again, we brought it to Kenya. It was contextualized. Globally, it has reached over 25,000 people. As Tommy said, the results have been amazing. The evaluations in Kenya and Zambia showed 50% reduction in among adolescents that had clinical depressive symptoms. But again, it's loved. 91% of adolescents who were in the study gave it the highest rating. Next. That is busy. I think it's just to show us that at the end of the day, what we want with MindSKILLZ is to have youth who are achieving their full potential and thriving. Yeah, we want to see reduced rates of depression and anxiety. We want to see increased interpersonal relationships. We want to really see reduction in issues of drug and alcohol and how they can manage their emotions and engage with positive peer pressure. Next. Yeah, so our collaborators are all here, the departments of health, Nairobi and Mombasa, LVCT, and the coaches. And that is how MindSKILLZ Kenya is implemented by a pair of coaches, both in person and take-home magazine. We have the coaches guide. We are already in the government health information system, very inclusive. MindSKILLZ now, it's not only for regular adolescents, but we're already targeting the teen mothers, adolescents living with HIV, with disability, refugee adolescents, and all that. Next. That is the package. When you walk behind there, as you'll be going for lunch, you'll get our coaches. They'll show you some of this package. We have the magazine with the guide. We've developed an disability inclusion handbook. Next. That is just a snapshot of what you will see inside. So it's very practical. One of them is the power breath, the Take 5. So some things that the adolescents can practice at home or in school with their friends on how to take a deep breath when they're anxious, and on the other side, you know, an exercise that will help them identify their own strengths and how they can use it for themselves and for the friends and the topics in the curriculum. Next. Okay. All right, so what next? We have a 5-year strategy. I don't want to dwell so much on this because there'll be a session where we will talk about it, taking it forward. So we are looking at reaching 2 million plus adolescents by the year 2030. That's our vision. We want to build the in-house capacity. We want to have different differentiated delivery models, including accessible digital solutions. And you know, we really want to make sure that we also have a sustainable financing model, and most importantly, to have a continuity of this annual stock taking through the summit. Thank you.
Thank you very much, Liz. So far we can do a Coca-Cola kilo. Sidio, who will help us do that very fast? We are trying to save on time. Come running. Come running.
So we can be upstanding. Thank you. So when I say let's give them a Coca-Cola kilo, we do like this. You do 3 claps on your left. 1, 2, 3. 1, 2, 3. Then make sure the Coca-Cola is on your left hand. Then you open. When you open, what happens next? What happens? Then, alafu na. Are we together? Tuko sawa? Tuko sawa? So let's give Madam Liz. Naona ako busy. Tuendelee? Okay, sawa. So let's give Madam Liz a Coca-Cola kilo. Thank you.
Thanks. We now invite Leonida. Please come.
So I was really waiting to stand here. In the in the morning, I was seated there and I was just trying to warm up how I can move all the way until here. But finally, I'm here. So standing on the already established protocols, ladies and gentlemen, good morning. Morning. Have we taken tea? Some of us are responding like we are there, we are not there, but if you've not taken tea, let's wait for lunch. I believe when you go for lunch, you'll be fine. So my name is Leonida Ayuma. I work at LBCT Health under the youth program. A MindSKILLZ coach supervisor supporting MindSKILLZ in Mombasa County. So as Liz had already mentioned, the coaches are the most important people in the MindSKILLZ intervention. They are the heart and soul. Say heart and soul. Sijawasikia bado. Mnajua heart and soul? They are the heart and soul of the MindSKILLZ program. Let's say it again, heart and soul. Heart and soul. Yes, so they are the most important people in this program, and they are here. So before I say what they do, I'd love them to just stand in 1 second and wave. They are across here. Coaches who are present, just stand and wave. Thank you so much. You can sit. Thank you so much for the good job you are doing. So as I wait for the digital team to proceed. Yeah, so as we had already said, MindSKILLZ is a fun, sport-based intervention that is youth-led, meaning this intervention is being done or is being implemented by young people who are here. These are the near peer mentors of these adolescents. They are young people who are almost not so much age mates, but at least they are young people whom these participants can easily interact with. The young people whom these participants can easily open up to and discuss issues, because most of the time you realize some of the issues that come up, these coaches, they can relate to. There are things that they have gone through, so it's easier for them to have a discussion and to be able to communicate and allow them to open up and support them as much as they need. Next. Yeah, so these coaches, as I said, they are the heart and soul of this program. They are recruited from communities where they are well known. They are from those, some of them have been born and raised from those communities, so they are well known by the gatekeepers, parents. If it's school, there are places where they are well known, so they support us in identifying these participants from those communities. Could it be in schools? Could it be at community levels? And they even go ahead and support us in sensitizing those stakeholders. Could it be parents of these adolescents? If it's in schools, they're able to sensitize the relevant stakeholders about the intervention so that they allow us to recruit the participants. So after they have sensitized them, they are able to support us to recruit the participants who meet the criteria, of course, to be part of the program. And then they go ahead and support us to deliver the intervention through fun-based activities, as I've been told, so that they're able to empower these adolescents to be able to speak up, so that at the end of the day, we're able to address the mental health needs of these adolescents. And then, apart from just delivering the sessions, they're able to support these participants to be able to get the support they require. They're able to refer some of them to be able to get the much support they need. So the support is in referral and linkages. And then during other interventions that happen at the community, they're able also to join those interventions. For example, if we have outreaches where health interventions are happening, the coaches are able to go there and deliver the intervention to the participants, so that at the end of the day, we have as many young people as possible participating from this intervention and benefiting from it as well. So they also support us in monitoring and evaluation. Of course, since they're the people on the ground, they're able to know if there are any gaps that we need to fill, if there are the best practices on the ground, they're able to tell us, and these best practices from the ground, they are able to support us to shape the program as much as possible. So we are learning. As we implement on the ground, we are able to pick the lessons, the best practices, and also we are able to identify the gaps and just shape them to make sure that we are able to implement the program and reach to as many young people as possible and support them to address their mental health needs as much as possible. And so they are also supporting us in program generation evidence, as I had said, the best practices, what is working when it comes to MindSKILLZ intervention at the community, maybe what is not working, maybe what we need to improve so that at the end of the day, the program is a success. And then, of course, adhering to the organizational safeguarding policy. Remember, MindSKILLZ is an intervention that is targeting adolescents and young people, so some of them are minors, so the coaches have been trained on safeguarding, they have been certified so that when they are working with the young people, they're able to protect them as much as possible. And at the end of the day, their role is to ensure that they are empowering these adolescents. As the earlier speakers had talked about mental health. Mental health is a big issue, especially among adolescents and young people. And sometimes it's overlooked, but it's a real issue. But through MindSKILLZ, these young people are able to speak up. It's providing them a safe space to speak up to their near peer mentors. It's a safe space for them to be able to speak up and be supported as much as possible. And remember, the coaches are trained, and we do a lot of refresher to just make sure they're able to support them as much as possible, and where need be, they're able to refer them to services as much as possible. So they're able to empower them to ensure that the mental health of adolescents and young people, they are addressed at the best level as we can. Thank you.
Thank you very much, Leonida. Coaches are the heartbeat of this intervention. Coaches, mko kwa nyumba? Hoi. Can we appreciate them? They are the heartbeat of this intervention, and we want to give them a fantastic kilo. Someone ran here very fast. Fantastic kilo. Halaka sana. Are there ladies in the house? Please come. It's not a, okay.
Let me maximize on this opportunity. So also the same for fantastic. We normally do 1, 2, 3, 1, 2, 3. Then because it is for us that we have done the job, but I consider it to be like a multi-sectoral approach, whereby also because of your part. So the moment we do our part, you do your part, then that's why we can be able to see such results. Indio. So when I say let's give ourselves, let's give to our fellow coaches a good job, a fantastic kilo. We do 1, 2, 3, 1, 2, 3. Then you say, you are fantastic. Sawa. Make sure point at any coach that you can see nearby you, or if you don't see them, exactly, you have me and Leonida. Are we ready? So let's give our fellow coaches a fantastic kilo. You are fantastic. Nice one. Thank you.
Thank you so much, Joseph. You are a very good young man. It's good to show up in such forums. You never know who sees you. Chazala, kindly.
So I want you to say, I love me with this demonstration. I is straight, and then love is, and then me. Sawa? Can we do it? I love me. Fantastic. You can have a seat. So I have only one slide, and this slide I can actually summarize it without having it here. I want to recognize the role of the partnership that we've been having throughout the implementation of the MindSKILLZ program. And all, if not all, majority of the partners are here. So I want to take this opportunity to first recognize the fact that we have worked together with the county government of Nairobi. County government of Nairobi, they are somewhere. You can wave. Thank you very much. That is specifically, we have the Department of Health, we have mental health unit, we have school health. We have worked closely with them since we started the program in 2022 up to now. We have the county government of Mombasa. Yes, I can see Ken. We have the rest of the team. Yes. So we worked with the Department of Health, School Health and Mental Health Unit. We had Selina here introducing and welcoming us to this particular forum. So I want to, in a special way, recognize the county governments of both Mombasa and Nairobi for helping us and aiding us through this process, because without them we wouldn't be able to implement this program in school or in the community. The second part of this partnership, we had organizations and social youth groups. Behind that barrier there, we have youth groups there. If we had all of them present the work that they've been doing on mental health and young people, and some of them we've worked closely with them with the MindSKILLZ, will take a lot of time. So we gave them that space behind there. Take your time, go see what they do. Those are our partners in the implementation of the MindSKILLZ program. There are youth groups, we have religious organizations, we have local football clubs that we've worked closely with them, children and care institutions. They've helped us identify young people in the community and provide the program in the community. We have other partners that are represented here. Some of them are not here. We have RCK in the house. Yes, we have KCA University. I'm not sure whether they came. We have Amut, we have Bom Hospital, Portrees Special School. Anybody from Portrees Special School? They did not make it. And other organizations that we've worked closely to be able to ensure that this program is a success. So thank you very much for ensuring that that was a success. Feel appreciated as we continue with the implementation in the coming days. Imagine nimemaliza.
Asante sana. Thank you so much.
So thank you so much. I wanted to national government, sorry. They were not there. The national government, we worked with Ministry of Youth Affairs. Ayako is somewhere? Yes, Ayako. Thank you.
Thank you so much. As Nyauchi, or just take the stage, I would want to read a quote here that can sum up our partnership. Great partnerships are built on a shared vision, mutual respect, and complementary strengths. Our journey reflects the power of collaboration. Together, we are shaping resilient, informed, and mentally healthy future generations. Is that true? Is that true? So thank you very much. We'll continue doing the same as we continue implementing the program. Yausi? Thank you.
Thank you. Good morning, everyone. Oh, it's afternoon already. We are going to make some quick presentation on what we've done in the last 2 years. As a first session of that, we would provide with you and to you information on the science activities that we've implemented globally, and then science activities that we're implementing in Kenya. The first phase of this presentation will be done by my colleague, Mercy, and then I'll pick it up from there. Karibu, Mercy.
Good afternoon, everyone. Yeah, my name is Mercy Kehio. I work for Grassroot Soccer, and I'll take you through the first session of the research presentation. So thank you. Yes, so Grassroot Soccer, as you have seen, is being currently and has been implemented in different countries. And we have research evidence in different countries to see how MindSkill is effective. So through 9 evaluation across 6 countries, GRS has found promising evidence for MindSkill mental health programs. So which are these countries that are being that these evaluations have been conducted. We have Kenya, we have South Africa, we have Zambia, we have Zimbabwe, among other countries that have proved that MindSkill is effective. So, sorry, for the MindSkill program, supported measurable positive effects on participants. This is depressive symptoms using the PHQ-9 and mental health well-being. So the PHQ-9 is given to participants. So a questionnaire is given to participants who have not undergone through the intervention. So we measure the scale, and then the participants are subjected to MindSkill and then do a post-intervention. So based on the pre and the post, there is promising result with PHQ-9. If a participant had scored high score, after the post-intervention, the scores decrease. And the same case applies to the WHO. And all these have reduced stigma beliefs around mental health. And we also conducted qualitative findings, and the qualitative findings also revealed positive outcomes in relation to MindSkill. And also there was some secondary effect of MindSkill. This is unintended outcomes in regards to MindSkill. And the most interesting thing that we realized is that there was improved school performance and classroom dynamics. And just as the previous chairs were discussing, that they need to promote the well-being of participants, and you cannot promote the well-being of adolescents without the school performance, without understanding their mental health. And this is one secondary effect of MindSkill. Also increased communication and sharing information about mental health with friends and families. And also we have seen a magazine that is here. So what happened is sometimes these magazines are very engaging, they have emojis, it's fun. So these young people are able to share with their friends, and this is one thing that it's an intended income that we did not even expect. So an improved coaches' mental health and well-being, and coaches are here, they can attest to that before they are, even through them sharing this curriculum, they are able even to open up in relation to mental health. Then we have the global evidence. So global evidence, we did a multi-country evaluation of MindSkill, and this is in-person programming. So for this in-person programming, we're using the routine data, and this data was from 2022 to 2024 across 4 countries, that is Kenya, South Africa, Zambia, and Zimbabwe. Just sorry, I'm missing to pronounce that. And then analysis included a total of 5,120 participants and 2,500 in MindSkill core programming. So you can see that we spoke earlier that there is integrated MindSkill. So we have, GRS has different programming. So let's say the skills programming that focuses on HIV. So there is integration of the MindSkill with that skills program, and we have MindSkill that is core programming that purely focuses on mental health, and that is what is called core programming, which is being implemented in Kenya. And the measures used was MindSkill pre and post questionnaire based on curriculum content, including items from mental health literacy skills. Okay, I'll be first. I don't know what's happening. Yes. So the WHO, this is 5-item measuring the mental well-being over the past 2 weeks. And it was administered to a subset of 1,742 participants. This is routine data for all those countries. And then the key result is that clinically significant improvement mental well-being. So an average pre-intervention of 69, and then post-intervention is 80.7. So you can see there is an improvement. Pre is before the implementation, post is after the implementation of MindSkill. And then there is an average and also statistically significant improvement from pre to post test scores. And then there was substantial gains in stigma reduction, help-seeking behavior, so adolescents will be able to seek mental health, referrals. They're able to share their mental health problem and mental health knowledge. Next slide, please. So around 2023 to 2024, MindSkill, we were able to implement MindSkill pilot study in partnership with LVZT Health. And our objective for this was to assess the effect of MindSkill experience of depression, emotional and conduct problems. The second objective was to explore the effects of MindSkills on mental health, knowledge, attitude, and care-seeking behaviors. And the third one was to explore implementation of the MindSkill program and magazine, including the barriers and facilitators to implementation, feasibility, and acceptability. Next slide. And our design method, we call the ITS design method. The ITS, we did the so we have, the ITS is a 4 sort of method. So we have time one. Time one, we recruit, with the help of the coaches, participants are recruited and we subject them to a questionnaire. Then we wait for 3 to 4 weeks and conduct the same questionnaire. And then there is the intervention period, which is around 6 to 8 weeks. So the participant went through a 12 session. After that, immediately we do the post-intervention and wait for 3 weeks and conduct another questionnaire and do another, we collect the same interview question. The purpose of it was to see, even, sometimes we conduct interventions and then you go to the field and you collect data, but we are not able to see you get the immediate impact because you have subjected your participant to a specific intervention, but after a short period of time, when you go back and ask them, we want to see if there is knowledge retention, and that shows huge improvement from time 1 to time 4. So this is the ITS design, and it was to measure the quantitative survey, that is the WHO, the PHQ-9, mental health literacy scale, MindSkill core questionnaire, and mental health implementation science tools. And we also conducted FGDs and KAIs. Next. For the data analysis is the quanti and the quali. So the quantitative, we used a segmented fixed effects, these are near regressions, to see the effect of all these time from time 1 to time 4. And the qualitative, we also conducted FGDs, were recorded, and we are able to transcribe and develop frameworks. Next slide. So based on the result, we have first is positive and persistent trends for every quantitative outcome measures. So this shows that MindSkill intervention itself is effective, because if all scores on key mental health outcomes trended in the desired direction. So from time 2, UC had shared time 1, time 2, time 3, time 4. And if a participant had scored, let's say, depressive, had, let's say, a 15, and then at time 4 down Nairobi, in Mombasa, it was community-based, and Nairobi was school-based, and a bit of mixing. So probably that can be a reason. Next. So you can see there is a sustained improvement in participant. You can see for the mental well-being at time 1, 74, time 2, and the scale improved. This shows that the MindSkill intervention is very effective, and mental well-being based on the sites are Nairobi and Mombasa, and you can see the same trend of improvement. Next slide. And this is the help-seeking improvement in depression symptoms, and you can see for PHQ-9, we expect that the scale will decrease. So for the first time, 5.4, and at time 4, we had 3.7. And also mental health stigma, we expect that the scale will decrease, and you can attest to that. You can see it has done that. For the support seeking, At time 1, support seeking, we expect the graph to increase. So you can see at time 1 is 14.5, and by the time we were doing the last post questionnaire, the result had improved from 14 to 16.7. And then changes in mean scores for participants showing greater difficulties at time 1. So for the specific participant that we identified that showed greater significance, we wanted to specifically measure these indicators for them, and you can see this scale shows desired result. For mental well-being, the participant that had difficulties, you can see there's for the WHO, you can see the graph from 36, this is the number 60, 66, 64, and 60. So there is an improvement. So 36, 66, 64, 68. So that is when, at the red part is where there's the blue color is when MindSkill was introduced. And also the depression of PHQ-9, you can see for the participant who had high depressive symptoms. And after MindSkill was introduced, you can see the graph has decreased. So this is lower proportion of participants reporting mental health difficulties over time. For WHO, 23 participants, that is 9.2, and all that decreased to 8.0. And the same case with PHQ-9, you can see a lot of people had scored high scores, that is 17.3. And after time 4, we had 22 individuals, that is 9.3. And there is a percentage decrease. So thank you so much for your attention. I'll hand it over to Bernard. Thank you.
Thank you very much, Mercy, for the good presentation. Colleagues, if you see what has been presented, one thing that comes to our attention is the continued movement of the graphs, even after the activities, intervention had been stopped. It's something that we still are querying amidst ourselves to understand what could have led to that level of momentum, that even after the intervention is ended, that period, the outcomes continued to soar or go down, depending on the directions that you are supposed to take. My name is Bernard Nyauchi. I work for LVCT Health. I'm in charge of evaluations. And we did this activity together with Grassroot Soccer. And I'll go straight to make a presentation on the qualitative findings, what we got out over and above what we collected from